Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And I wanted to go over this sample step one exam, USMLE .org question. This is within one of their sample questions, so it's not very difficult to go through quickly and look over and see which one is the correct answer. I have lectured on clinical trials, but understanding the clinical trials on a superficial level sometimes does not provide you with enough information to be able to answer some of these questions, which involve some very specific information within the content and stem of the question. So it's not only important to learn the concepts as you're moving along and going through the material, but understand how this works in the context of different studies and scenarios. So within this, the main context is that a study is designed to evaluate the feasibility of acupuncture in children with chronic headaches. So 60 children with chronic headaches are recruited for this study, which is actually not an unreasonable amount. In addition to their usual therapy, all children are treated with acupuncture 3 times a week for 2 months. Which of the following best describes this study design? So this is where your understanding of epidemiology really comes into play. And I do know the answer, unfortunately, was not covered here. So you get a sneak peek at it before you even get to look over the answer choices. But ideally, the way you want to do this is you want to then go over each one of these choices and see if you kind of within your head can go over the type of study design that each one of these are referring to. So for instance, in a case control study, you know that the controls have been selected and the cases kind of have been determined. And so it's from the perspective of that. And so in this case, you don't have anything like that going on. You basically have 60 children who are being treated, who are recruited and are just being treated with acupuncture. So that's why the case series study, it's a group of patients that are being studied, makes the most sense. There's no comparison group whatsoever, so that automatically basically excludes any other type, because with case control, there's a control group, randomized clinical trial, typically have a control group. Even in historical cohort, or another way to say that is like retrospective cohort, you're actually going back to look for the exposure, historical exposure, to look for relationships with outcomes. Even in a cross-sectional, even though the variables might have been collected all at the same time, the variables actually, there's actually a kind of a comparator group. And this is why there's a PICO. So this is the same group of patients that are being followed. So I hope this has made sense. I hope this lecture has made sense and also provided you with some insight as to how you do need to know the information about epidemiological study designs in a thorough fashion, along with knowing the most appropriate and pertinent measures of association. If you know these, and if you know the strengths and limitations of each one of these, and the level of evidence that it suggests, then you'll be good to go for the USMLE. Thank you for listening.